Have you been experiencing pain on the outside of your elbow over here and doing simple activities such as grasping, lifting, or even simple tasks are painful and challenging? Then you might be having a condition named as tennis elbow. And that is what exactly we'll be discussing in our today's video. Welcome back to TanuWellness, your Physio and Pilates Hub, and I'm Dr. Tanushree, your Physio and Pilates expert. In today's video, we'll be discussing exactly what tennis elbow is, what are its different causes, and what are the different treatment options. I understand tennis elbow can be really painful, but with the right treatment, it can make a big difference in your life. So don't worry, in this video, towards the end, there is a bonus section where I'll be showing you top 5 exercises, effective, simple exercises that can help you with your elbow pain. So stay tuned till the end. And here's what we are going to cover today. First, we will see what exactly is tennis elbow and how it affects our elbow joint. Because sometimes it happens, you have pain on the outside of the elbow and different activities become challenging, but you don't know whether it's tennis elbow or it's just a pain. So that's what we'll be discussing. Then we will be seeing the difference between tennis elbow and a similar condition known as golfer's elbow. We'll also see different causes of tennis elbow and discuss the onset of symptoms and how they present themselves. And like I mentioned before, towards the end, there is a bonus section where I'll be demonstrating 5 simple exercises that will help you recover from this condition. So stay tuned till the end. Let's get started. If you're new to my channel, TanuWellness Physio and Pilates Hub, then don't forget to subscribe to my channel. Do click the notification bell so you don't miss out on the weekly physiotherapy videos and wellness advice. If you found this helpful, then do share with your family and friends, and especially with those who are suffering from this condition, tennis elbow, because that will definitely help them get rid of tennis elbow. So what exactly is tennis elbow? Tennis elbow, medically known as lateral epicondylitis. Lateral means outside. In tennis elbow, the pain will always be on the outside of your elbow. The pain occurs where the tendon of your forearm muscles attached to the bony bump on the elbow known as lateral epicondyle. So here you will have pain and tenderness. The condition is often associated with repetitive or overuse motions such as seen in gardening, painting, typing. All these repetitive movements causes small tears in the tendon, causing a lot of inflammation. They say tennis elbow is seen in tennis player. Yes, it is, but it's not true that's only in tennis player. It can affect any one of you, and especially if it's seen in people who are in repetitive typing on your laptop. And nowadays people they are there on their laptops for a long time, so it's a very common condition. It can be simple tasks such as shaking of your hand or even lifting a cup can be challenging if you have tennis elbow. If left untreated, it causes a lot of inflammation, and if it's not treated on time, it can affect your arm in such a way that your strength will be completely lost. Let's talk about the onset of your symptoms. The onset is usually gradual, slow, starting with mild pain or discomfort on the outside of your elbow over here on the lateral epicondyle, like I mentioned at the beginning. The pain might be triggered by activities that involve gripping, grasping, lifting, or even twisting motions. Over the period of time, the pain can become severe, radiating down towards your forearm, making it difficult to perform simple tasks that require wrist movement. So when you start having pain over here, do not ignore, immediately apply ice pack so that it doesn't reach the stage where you have chronic pain. If you are finding this video helpful and information useful, please take a moment to like this video, share with someone who might need it. Your support means a lot to us and it helps us to create more valuable content like this. Let's dive into the common causes of tennis elbow. While the name suggests tennis elbow, it's not true it's seen only in tennis players. It can affect anybody who uses a lot of wrist and arm movements, which involves extending your wrist and fingers. This repetitive motion can occur in sports such as tennis, squash, badminton, where the same arm movements are performed repetitively. Also seen in carpenters, plumbers, people, homemakers, where in kitchen they are repetitively moving their hands or wringing of your clothes. So there's a variety of people with different population can have this particular condition. Poor technique in these activities is the culprit. Combined with inadequate muscle strength, it can worsen your condition. So remember, in some cases, a sudden injury or trauma can trigger the condition, but it's commonly seen in people who use repetitive motion of your wrist and arm. When it comes to treating tennis elbow, there are several alternative therapies that help in reducing pain and promote healing. Physiotherapy is one of the most effective treatments that focuses on strengthening and improving the flexibility of your tight muscles that put a lot of strain on your tendons. So once you improve the flexibility of these muscles, automatically the strain will be reduced. Towards the end, there's a bonus section. Like I mentioned before, I'll be demonstrating 5 simple exercises that will help to strengthen the muscle and also reduce your pain. Another option is acupuncture. Acupuncture is where you insert needles on the tender point that helps reducing pain. The third option is massage therapy, where the deep tissue massage is given that breaks down the scars and enhances blood circulation. And whenever you have tennis elbow, try applying ice pack, like I mentioned before also. Keep it for 15 to 20 minutes. That can be done several times a day. This will help in reducing inflammation and pain. So try these alternative therapies with combination of right exercises that will help not only reducing pain but also will help in strengthening your forearm muscles, in turn reducing your tennis elbow pain. Before we dive into the exercise, it's very important for us to know the difference between tennis elbow and golfer's elbow. Now, tennis elbow is always seen in people who use lot of wrist extension movements. In golfer's elbow, people who use lot of wrist flexion movements, which is commonly seen in golfers, seen people who lift weights. While tennis elbow and golfer's elbow always causes inflammation, pain, tenderness in the tendon of your elbow joint, but the area is different. In tennis elbow, there is pain and tenderness always on the outside of your elbow joint, while in golfer's elbow, the pain is always seen on the medial side. So to understand whether it's tennis elbow or golfer's elbow, check the area. If it's in outside, it's tennis elbow. If it's inside, it's golfer's elbow. And it is important so that you can have correct diagnosis and start your exercises accordingly. And here's our bonus section. In this, I'll be demonstrating 5 simple exercises for tennis elbow. Before we start the exercise, it's very important to warm up your muscle. So for that, what you can do is, first is, this is your affected hand where you have tennis elbow. Just rotate your wrist in and around a couple of times. That will enhance the blood circulation. And the second thing is, this is your tendon point, which is the inflamed area. With 2 fingers, you can do light massage. And once you feel a little better, then you can go a little deeper. So cross deep massage can be done in that particular area. Now we start the exercise. Exercise number 1 is wrist extensor exercise, which means you're going to first stretch the wrist extensor. You're going to place your hand comfortably on a plinth or a table, whatever is comfortable, and then gently you're going to push your wrist downwards. And with the support of the other hand, push it down until you feel a nice stretch over here. This is when you have a lot of pain. Otherwise, you can hold your hand here with the support of the other side. You can press it down and hold it for a few seconds until you feel a nice stretch in this particular wrist extensor area. This is exercise number 1. Now, exercise number 2 is working your fingers. So you can use a rubber band or you can use something like this where you can keep your thumb inside. With the other fingers, you can just move out and in like this. This also works wonderfully for your fingers, enhancing blood circulation, and this can be done a couple of times in a day this way. If you have a lot of pain, if you feel this is too much of resistance, then you can do with a tennis ball, or you can do, like I mentioned, a rubber band, or like this, in and out. This is exercise number 2. Number 3 is, now we work towards strengthening exercise. For this, you can just use a light weight. You can use a dumbbell, a bottle, or a weight like this. Keep your hand again placed comfortably like this, relaxed hand. Hold a dumbbell or a weight in your hand, depending upon the intensity of your pain. Completely keep it down and then slowly go up and down, up and down. Focus on holding the dumbbell tight and then pushing it down, and gently with the support of the other hand, come up, down and up. So here we are working the muscles of this particular area. Number 4. Now we used a dumbbell. Now we'll use a little more resistance. For that you need a resistance loop. In this you're going to place the hand again, and this is the movement I'll be doing. My palm has to be facing up. So I'm going to go up and down. So here we have to remember we are trying to strengthen all the muscles in this particular area so the pain reduces. So you use a loop around the hand, keep it vertically, thumb upwards, hold it here and up and down. With the other hand, you're trying to pull the band. Do it couple of times. This exercise can be done 5 to 10 times depending upon the intensity of your pain. You see all these muscles are working here. This is a resistance supination exercise. And the 5th one, what you can do is try after these exercises, first apply ice pack. So that will help in reducing your inflammation. And then you can use another bottle or a weight and keep your hand vertically, go up and down, radio ulnar deviation. So you, like I mentioned, once you feel feeling a little better, you can use a heavier weight, but initially start with a lighter weight. I go up and down. This also can be done 5 to 10 times. If you're finding it difficult, then you can use the support of your other hand. Keep it over here. Keep the thumb up, down, down. End of the day, you have to work on these muscles. So first is you do circulation, warm up, then you try to stretch the extensor muscle, then you strengthen, then you progress to a resistance, and towards the end, ice pack is a must. So try these 5 simple exercises for this condition and see the difference. And that's a wrap up for today's video. In today's video, we covered everything from what exactly is tennis elbow, how it starts, common causes, alternative treatment therapies, and we also saw the difference between tennis elbow and golfer's elbow. In our bonus section, I demonstrated 5 simple exercises that will help in reducing tennis elbow. Remember, consistency with these exercises and early intervention can make a big difference in your recovery. If you found this video helpful, like I said, please subscribe and share with your family and friends, and especially people who have tennis elbow. Don't forget to subscribe and click the notification bell so that you don't miss out on our other physiotherapy videos. Thank you for watching. See you next time.